Hi friends, welcome to our YouTube channel Doctors for Doctors. Today we'll be seeing about one of an important exam which will be scheduled from 2022, that is the next or the national exit test or the national exit exam. Video we'll be seeing about what is next, when will it start, how many parts the exam will be conducted, who are eligible, what is the currently proposed pattern, and how and what to study. In the last 8 to 10 years, the pattern of postgraduate medical courses, entrance for the postgraduate medical courses is changing from time to time. We saw initially there was all India exam, there were separate state common entrance tests, separate university common entrance tests, which were abolished since the year 2013, and since 2013 we have a single entrance exam for government and private institutes, except for a few premier institutes like AIIMS, ZIPMER, PGI Chandigarh, etc., and that is known as NEET PG. Now, the proposed pattern is to abolish the NEET PG exam and come up with another exam, that is the National Exit Exam. There might be many questions which might be arising in your mind as to what is next, how many parts, what will be the pattern. So we'll try and answer here few of your questions. As we saw, next is nothing but a single national level common entrance test, which is at the national level and is a MCQ based exam, which is computerized format, and it will be in how many parts? As we saw, it will be in conducted in two parts basically. From which year will it be scheduled? It will be scheduled from the year 2022. So the students who are appearing in their final exams in the year 2020 or will be giving the NEET PG 2021 will be which will be probably the last NEET PG that will be conducted, after which the pattern of the exam is going to change, and from 2022 there will be next exam. We'll see what is the pattern of the exam that is proposed. The pattern of the exam that is proposed is the exam to be conducted into two parts, part 1 and part 2. Part 1 will be a pre-internship exam, that is before you start with your internship, you need to pass the part 1, which will be a 3-day long exam. That is what is being proposed presently. There will be day 1, day 2 and day 3 papers. Day 1 will be related to medicine and related subjects, which will be divided into two sessions, the morning session and the evening session. The morning session consisting of 120 questionnaires, the evening session consisting of 60 questionnaires, the morning session of 3 hours and the evening session of 1.5 hours. That is what is being proposed. So the related subjects are basically dermatology, psychiatry, that are related to medicine. In the evening session, probably there will be a pediatric paper and its related questionnaires. Okay. The day 2 paper that is being proposed is surgery and related subjects, again divided into morning and evening sessions with 120 and 160 questionnaires respectively. Surgery related subjects include orthopedics. In the evening session, probably you will be having an paper on ENT. On day 3, what is being proposed is obstetrics and gynecology, which is in the morning session, and in the evening session you have nothing but ophthalmology. Now what you need to know is what happens if you pass or fail the next exam. So there are two possibilities, that you either pass the fail exam, pass the next part 1 exam, or fail the exam. So if you pass the next, what you need to pass the next part 1 exam, so that you are eligible for your internship. Okay. If you fail the next part 1 exam, you will not be eligible for your internship. Secondly, for all the foreign graduates, it will be compulsory to pass the next part 1 exam to practice internship in India. If they fail, they can't practice nor they can come for internship in India. Okay, nor they can do internship in India. Thirdly, the score that you get in next one will be considered during your postgraduate entrance exam and that will be considered for 2 to 3 years. The score will be eligible for 2 to 3 years. This was all about the part 1 exam. Okay. Now, once you pass the part 1 exam, you become eligible for part 2. That is, first you need to complete your internship for 1 year after part 1 exam, and after completion of your internship there will be the part 2 next exam, which is a post internship practical exam. Now this practical exam is basically to check your emergency and skills that you have learned in internship. So basically they'll be seeing certain things like whether you know about basic life support care, whether you know about advanced cardiac life support care, whether you know about pediatric life support care and advanced pediatric life support care, whether you know about ATLS, whether you know about emergency, basic emergency medical obstetric care. Okay, so the governing body basically wants to see whether you know the basic skills and whether you are able to manage emergency patients. Okay, and provide a proper referral whenever required. Okay, so from my point of view, this part 2 exam is a good step taken by the governing body, as the interns will be more keen on learning new things and new skills. Okay, but what I feel is that the exam, since the part 2 exam is planned, the students should be basically taught initially about what the exam will be, how it will be scheduled, and what all skills they need to learn from this exam, for skills they need to learn for this and how to prepare for it. Okay, so they need to give this basic training to the students before starting this part 2 next exam. That is what I believe, but it is a good step from my point of view. Now friends, let's see what happens after you pass part 1 next and part 2 next. So once you have passed part 1 next, you will be eligible for internship, and then you need to pass the part 2 next. After you pass the part 2 next, then only you will be eligible to practice in India. Okay, after you pass the part 2 next exam, you will be eligible for postgraduate courses. Now which marks will be considered for your postgraduate courses is the marks that you have scored in part 1 exam. Now what happens if you pass part 1 but if you fail part 2? There will be a re-examination scheduled for you, that is mainly the part 2 exam. This is what is being presently proposed, and if you pass in that, then you will be able to practice and you'll also be able to apply for PG courses. Again, in this case, the score that will be used is of part 1. Okay, now these are two scenarios. There is another scenario where you pass the part 1 exam, you pass the part 2 exam, but you are not getting the PG course of your choice. So next what? Then there is a proposal that you can re-attempt the next one exam, okay, for betterment score. And if you get a good score in the next part 1 exam, this score will be used for your PG courses application. Okay, now there is another thing that the students have queries is what happens to the students who have passed before 2022? How will they enter the PG courses? Okay, the students who have passed before 2022 are eligible to practice in India, but for from 2022, if they want to get through the PG courses, they need to give next one exam and they need to get a good score, which score will be eligible for their PG courses. Okay, these are the various scenarios. If you still have any doubt among about what happens if you pass or fail, you can message me. I'll be keen to reply to it. Okay. Next question that arises in the mind of the students is as to what to study and how to study. Now, how to study and what to study, you should basically know what the pattern of the exam, what are the things they'll be asking in the exam. Okay, so what is being proposed is 60% of the questions that will appear in the exam will be problem solving questions. Okay, 30% of the questions that will appear in the exam will check your comprehension and analytical skills. 10% of the questions that will appear in the exam will be basically recall based questions. Okay. Now, out of these questions, what is being proposed is 10% of the questions will be from applied basic sciences, that is anatomy, physiology, biochemistry, etc. And 10% of the questions will be from preventive and social medicine. Okay. So, what is the proposal is you should have a problem based approach. So basically they want to check your clinical skills. Now your clinical skills basically develop in the IPD. So you need to attend more and more clinics, see more and more patients. Okay, try to diagnose more and more cases and try to see what treatment is going on. Okay, and try to learn what will be the differentials for the same patient, right? So this is what they are basically trying to see. I'll be giving you a few examples as to what the question pattern might be here. Okay. Previously, the questions that were being asked in the PG entrance exams were basically recall based questions. Now I'll give you an example. Previously, the questions were like nerve involved in Erb's paralysis. Okay. Options C3, C4, C5, and C6. Now, as we all know, the most common involved nerve in Erb's paralysis is C5. Okay. C6 is less commonly involved, so the answer here would be C5. Now, with the change in the pattern, the question would be like a 30-year-old male presented to you with history of fall on shoulder, okay, with his arms adducted and medially rotated, his forearms pronated and extended position. Okay, so what is the probable diagnosis? Options are Klumpke's paralysis, second is Erb's paralysis, third is injury to lateral cord, fourth is injury to serratus anterior. Okay, this might be the question that might, which this is a basically a question which will check your problem solving skill. Okay, now coming with history of fall on shoulder with arms adducted, medially rotated, with forearm pronated and extended is nothing but a policeman's. This is what known as, my friends, policeman's tip hand deformity, right? So this is usually seen in Erb's paralysis. So you need to know that the arms are adducted, medially rotated with pronated and extended forearm is nothing but seen in Erb's paralysis. Now they might go a step further and they might ask you, is 30 years male coming to you with history of fall on shoulder with the following deformity, that is arms adducted, medially rotated, forearm pronated and extended. Which of the following nerve is involved in these cases? So for this, you need to know that the above question is about Erb's paralysis. Now, since it is about Erb's paralysis, we know the most commonly involved nerve in Erb's paralysis is C5. Okay. and less commonly C6. So the answer here will be again C5. So this is how they check your problem-based solving and analytical skills. Okay, this is one example. The above example which we saw about herbs paralysis describes basically how the applied sciences come into clinical practice. Okay, now I'll give you another example. A 50-year-old male, after winning a lottery, had a party at his home in which he drank 450 ml of alcohol. Okay, after few hours he presented to you with palpitation and a BP of 95/50. Now what is your probable diagnosis? The options given are atrial flutter, next is paroxysmal atrial fibrillation, next is sick sinus syndrome, and then we have what is known as the ventricular tachycardia. Okay, so these are the four options. Now a 50-year-old male coming after a consumption of alcohol with history of palpitation with fall in the BP. If you remember, there is something called as alcohol holiday syndrome. So which is basically seen in atrial fibrillation. So this is probably a case of paroxysmal atrial fibrillation. Okay. Now I'll give you another example so that you understand how the problem solving questions appear. Suppose there is a 30-year-old female who presented to you with anemia, okay, that is not resolving with iron therapy. Now the last iron therapy was given 3 months back. Still the patient is not improving. You see her CBC profile. It is shows hemoglobin 9 gram per deciliter. Okay, the MCV 69 which is low, MCH is 22 which is again low. Okay, the WBC count here is normal. Okay, the serum iron levels are normal. Next, serum ferritin levels are high. Okay, the total iron binding capacity is normal. Hemoglobin electrophoresis is also done, which appears to be normal. Now, what is the differential diagnosis? Okay, sorry, what is your probable diagnosis? Whether it is iron deficiency anemia. Second is anemia of chronic disease. Okay, I forgot here CBC profile ESR is also normal. Third, whether it is sideroblastic anemia or whether it is put beta thalassemia trait. Now this question will check your analytical skills as well as your problem solving capacity. Now we know this is hemoglobin 9 which is anemia for sure. Now we see the MCV and MCH, okay, both are low. So this indicates that it is what? Microcytic hypochromic type of anemia, right? Okay, so we know that microcytic hypochromic anemia is seen in iron deficiency anemia, it is seen in sideroblastic anemia, it is seen in beta thalassemia trait. Now we need to rule out one by one. Now why it is not any, okay, now since iron levels are normal, ferritin is high, total iron binding capacity is normal, so it is not iron deficiency anemia. Okay, now the serum ferritin is high. It can be high in anemia of chronic disease, but most commonly in anemia of chronic disease the picture is normocytic normochromic type of anemia, right? Okay, another thing in anemia of chronic disease, there are signs of inflammation and the ESR is rarely normal. So This can't be anemia of chronic disease as well. Okay. Another thing is we remain with two conditions, beta thalassemia trait or sideroblastic anemia. Now, if you see, there is hemoglobin electrophoresis done where hemoglobin electrophoresis is basically normal, means beta thalassemia trait is ruled out. Okay, so the answer here is sideroblastic anemia. Okay, so these are basically what kind of questions can appear in your next exam. So you need to start preparing and updating yourself for this exam. Finally, keep yourself updated. Do write to us in the comment section if you want more about the MCQs which might appear into the next exam. We will be there to guide you. Do subscribe for our latest updates at Doctors for Doctors channel. Thank you.